Because you have a family, you have kids, lazima ungangane waone. My friend ako in this with a lot of passion because aliluzi mamake na cancer. So watoto ni ngumu wajieleze. Mtu mkubwa hata unaelewa cancer ni nini, unaelewa, but mtoto akiwa mgonjwa yeye anajua tu I'm sick nateseka because niko mgonjwa. So that is why tuna create awareness. Tunataka kuanzisha foundation ya cancer center ya watoto
hapa Nakuru.
Nakuru.
Raise funds. You can support us by taking a picture and sharing on your social media with us. If you are allowed to take this picture. And also,
I'm allowed.
Yeah, you are. Yes. Thank you.
you see, by sharing, you can get your picture or at your convenient time. If you don't mind, we can add you to a group we have where we share our website, and you can be able to follow us through
Unaweza changa
as little as 10 bob. The little amount is 10 shillings. Yes, my name is Nyariki, a teacher and also a cancer awareness advocate. So today I've been joined by other cancer awareness advocates in a walk which we started from Kuresoi North to Molo, and yesterday we were at Njoro, and we arrived in Nakuru yesterday. So today we are flowing off this walk from here Nyayo Gardens, and then we walk through to Bahati, then to Gilgil, Naivasha and Nairobi. This work is about creating awareness on early diagnosis for cancer, and also talking about toxins being used in our farms, in our food, which are making us to contract this disease. And also we are talking to government agencies so that they may declare cancer as a national disaster. So join us in this work by contributing, by supporting us, and also by sharing these messages across all social media platforms, because we can all support this and also lead to making cancer a disease which is manageable. The main objective of the work is to raise funds for our kids cancer center, which we are looking forward to setting up at Lanet, which will be offering palliative care for cancer kids of less than 12 years. This work we are going to do, we started on 11th, on Saturday, from Kuresoi North, from the farm of one of our colleagues who lost his son, and we'll do it from 11th to 18th this month. So we have 7 days of the work, and today is the third day. Today is the third day, so we are looking to 4 more days until we arrive in Nairobi, and we put a message on the wall that we can all arrest cancer, we can do something to make cancer manageable. We are working with my organization called People Power Differently, which is working for persons with disabilities and also cancer advocates and cancer patients, and also in partnership with Josephine Irungu Foundation, which is also offering palliative care for patients, and also offering awareness campaign to people who have been affected with cancer.
Hi, good people. My name is Lydia. Having battled with cancer for 3 years, this is the 4th year. I'm only appealing to well wishers and people of good faith to support this program because fighting cancer cannot be done by one person. It requires a lot of resources. So I'm requesting all of us to help in any way possible. You can give your 10 shillings, you can give your 100, you can give your 200, 1,000. It will take us a long way. Support Nyariki, support children suffering from cancer. Thank you.
We have set our short-term goal for these 7 days, but it's going to go beyond that because you can join us in our website, peoplepowerdifferently.org, whereby we are going to have a lifelong programs. We have several programs to ensure this to ensure we realize this objective of the cancer center for kids, because this cancer center will cost 100 million. So we're looking forward and we anticipate that by the end of the 7 weeks, wherever we will be, we'll be able to continue to do in other platforms, fundraising with other donors, fundraising with other government projects, so that we ensure we realize this dream. By all means, we are going to realize this dream by a walk, by online fundraising, by also doing proposals to organizations. So it's not going to stop at the work only. This is something we are going to do for as long as we are living. We are going to do something for our kids, because as we know, kids, adults can understand the pain they go through, but it's very, very hard for kids. For those who have interacted with, for those caregivers who are having cancer kids, it's very hard to explain to kids. That's why we started with the Cancer Kids Center. So join us in our website. We have our website we are going to share with you. It's online, so that you can keep on raising awareness and also supporting this initiative. Some of the parents are able to interact. They have no language to explain to kids who have cancer. We want to have this center, fundraise for this center, so that they can be provided.
You come out and create awareness. Watu huwa waamini, wanaona ni kama ni story tu. So mimi nilikuwa diagnosed 2023 na bado naendelea na matibabu. Nimekuwa nikitibiwa medical hapa na Liberty. So cancer si rahisi.
Yako ilikuwa umejua waliitambua ikiwa stage gani?
Stage 4. Na ndio huyu mimi sasa. Yote ni juu ya Mungu na support yenye tunapata. Hawa ndio wamefanya tukakuja learn, when you get open, you accept, you become positive and fighting becomes so easy. Lakini ukijinyamazia nyumbani, you easily give up.
Stage mbaya kabisa.
Yeah, lakini cancer is not about stage. Cancer is about being positive, following instructions za daktari wako, eating the right food ile yenye umeambiwa, na Mungu atakusukuma mpaka ile siku atasema sasa umechoka kuja pumzika.
Na causes zake sasa haswa na nini? Causes imekuwa too much.
Eh?
Causes za cancer ni nini?
Causes za cancer ni mingi.
Yeah.
Zile zenye nimejifunza kutoka kwa daktari wangu, kuna ingine ni genetical, inakuwa passed from one in the family lineage. Then ingine ni about the kind of foods tunakula. Hizi processed carbohydrates, masoda, sukari, wheat. Alafu saa hii farming unaona imeenda a high level. Tunatumia madawa kulima, kupalilia. So at the end of the day, madawa iko mingi kwa miili yetu. Then kuna vitu kama radiations, wale watu wanafanya kwa industries nini, mali radiations zinakuwa emitted. The causes are so many. Na ni vile mtu kama mimi niligundua niko mgonjwa kama imefika stage 4. Unaenda hospitali, unasema tumbo inaniuma, unatibiwa tumbo, kichwa inaniuma, natibiwa kichwa. By the time inakuja kugundulika, naona imetembea almost. Ilikuwa breast, but ilikuwa imemate to the liver and the bones. So ukigundua ikiwa late, treatment process pia ni mrefu. Unatibu kwa miaka mingi. Lakini ukigundua mapema, unatibu mapema na inaisha.
What are the signs?
Signs sometimes ni ngumu because unaweza kuwa na kansa kwa mwili and you don't even feel pain. Unaweza kaa hata na tumor kwa mwili for hata 20 years, you don't feel any pain. By the time you feel the pain, huwa imeenda. Labda rafiki yangu ataongeza.
Explain hapo. Naweka aje? Okay. Umeuliza symptoms. Cancer, all parts of our bodies can have cancer. Kama kuna cancer of the eye, of the bone, of every part of your body. So kitu yenye inafanya any pain you have in your body, it can change and become cancerous. It depends on ile diagnosis yenye utafanyiwa. Sasa uwezi jua kwamba hii pain ni ya cancer ama si ya cancer. Ukiona persistent pain, kitu tu unaweza fanya ni kuseek proper medical advice. Sasa uende ufanyiwe ma check up, ma MRI ndio uweze kujua kama uko na cancer. Mimi pia I lost my mother 2 years ago. Kwa sababu pia hatukuwa tunajua. That's why I'm doing this. We stayed for a long time to treat this pain na painkillers until when we realized it was very late and we lost her. Several people, we've lost our family members because we don't know and because of those persistent pains zenye tunachukua ma painkillers na kumbe cancer is growing and at the end you spend a lot of, I used to have a car. We sold cars, tuliuza mashamba. So ukiona tumejitolea hivi tukitembea hivi, we are trying to preach to people out there that if we don't take precautions, kama hatutafanya early diagnosis, cancer can be able to, it can take everything which we have. Ndio maana hata tunataka government agencies watu protect pia kwa kufanya nini? Kwa kusaidia kutoleta hizo chemicals kwa supermarkets. Unajua pia hizo chemicals zikifika supermarkets sisi tunazitumia, si ndio? Zikifika shambani tunazitumia. So this work is also urging government agencies, regulators like Kenya Bureau of Standards waweze kufanya nini? Waweze kuzuia zile toxin chemicals zenye zinatumika. Some of the chemicals ziko banned in Europe na zinatumika hapa Kenya kama herbicides. Kuna some herbicides I know have been banned in EU markets and are being used in Kenya. Those are one of the carcinogenic substances which causes cancer. So thank you so much for listening to us and keep on spreading this message. Sawa sawa.
some of us have been affected. That's why we